Yeah, good evening and welcome to the channel. Today we start with a story and we start with the story of Dr. Jon Snow. Now, it's not the Jon Snow of Game of Thrones. This is the Jon Snow of public health. Now, this Dr. Jon Snow was an Englishman. He was a doctor. He was working in London. And his story is interesting because he used to attend to a lot of patients. Patients used to come in to see him and he would attend to them. Now, he found out that at a particular time, an unusually high number of patients came in to see him, and all these patients came in complaining about diarrhea. So he was treating them, treating all the ones that were coming in to see him. But after a while, he began to ask himself, why are all these patients coming in with diarrhea? Why are they all having the same problem? So he brought out a map of London, and started to ask the patients, each one that came into his clinic, started to ask them, where do you live? And then he will make a tick on the map and then he'll treat them. But after a while, he noticed on his map that most of the patients who came in, with one issue or the other seemed to live within the same vicinity. And so he started to wonder. Now they were coming in with diarrhea, which is caused by the bacteria Vibrio cholerae. So, and this is an airborne sickness. And so he, started to wonder what's going on. So he started to ask them, what's their water source? Where did they get water from? And they told him that they were getting water from a particular pump, a tap on Broad Street. And so he asked so many people and found out that all of them were getting their water from this same source. And so, rightly, he suspected that this source of water was contaminated. So he went and destroyed the head of that tap, that pump, so that people had to look for other places to, get water to drink and bath and do their cooking. And then the incidence of the illness just subsided. It went down and people stopped coming to his hospital. So he's being looked at today as the father of public health, the father of epidemiology, because he was the first person, who took it beyond just sitting at the desk and attending to patients. He did intervention that could help population. And so that brings us to what we are discussing today. We are doing an introduction to public health. What's public health? Public health is that science or aspect of medicine that is interested in the health of population. It's not a science that is, targeted at an individual, but no, it's targeted at populations. So any intervention, any measure that is taken in order to help the health of populations, not necessarily the health of individuals, is what we refer to as public health. And it's an interesting aspect of science, and it's important for us to note this interesting aspect of science. Now, it's also important to note that, we should look at the difference between clinical medicine and public health. Now, I talked about populations, and when you say population, you are referring to a group of people who have a common thread, who have a common denominator, who have something that, is common to every member of that group. So, if you talk about the population, it could be geography. So, if it's geography or location, you could say, okay, number of people living in a particular town, number of people living in a particular area, they make up a population, fine. But that's not only the thread that could join a lot of people together. So it could be women, pregnant women, for an example, they form a population. So if you have pregnant women in Africa, they form a population. If you have pregnant women in the whole of Europe, if you have pregnant women in a particular village, city, or town, they form a particular population. If it is men who are smoking, or men who have diabetes, or men who have prostate cancer. So the idea is that when you talk about the population, you're not just talking about a people within a location. No, you're talking about a group of people that do have a common thread. And this is important for us to note. Now, it's important to understand that when you're talking about population in public health, you realize that the difference between the focus for public health and clinical medicine is that clinical medicine is focused on the individual. So normally you go to see the doctor by yourself, and then except maybe perhaps you are a couple or something, usually most of the time you see the doctor just by yourself. But when it comes to public health, it's intervention that is targeted at populations, at very large group of people. So the focus is not just for an individual, but the focus is for a very large population. This is important for us to know. Now, there are some concepts that we'd also like to discuss. First being population health. So just like as I've been harping upon, the in public health, you're interested in population, you're interested in a large group of people. You want interventions that can affect a very large group of people and not just one person. Secondly, public health is prevention oriented, meaning that it tries to nip the problem in the bud. So public health does not want these illnesses to become full blown. So whatever can be done at very elementary and rudimentary stages to make sure that this illness does not graduate to what becomes a debilitating illness or a life-threatening illness is what we refer to is what is done in public health. So it's prevention oriented. It focuses on the population. Now, in public health, we also have what we call social determinants of health, which is very important when we discuss public health. So when you talk about social determinants of health, you talk about those factors that play a role: socioeconomic factors, education, access to healthcare, all these factors that play a role in determining how well a person will live, how healthy an individual or a population, we are talking about populations, how healthy a population will be. These factors are what we refer to as social determinants of health, and they are very important for us to note. In public health, we also want to look at equity and accessibility. Now, when you say equity and accessibility, you want to have interventions that a lot of people can have access to. And then you want to have intervention where a lot of people will not only have access to, but to be available to them. They can, simple interventions that people can reach out to. Now, it's also important to know that public health is evidence based. The practice is an evidence-based practice. And what do we mean by evidence-based practice? In science, we don't deal with fallacy, we deal with figures, we deal with data. And so public health wants to analyze data, wants to analyze interventions, it wants to make sure that there is solid data that is backing whatever theory, whatever hypothesis, whatever intervention that the professional wants to do. And so this is important to note. It is an evidence-based practice, and there must be evidence, there must be data that corroborates. There must be scientific research that has been done that corroborates or that makes an intervention, scientifically viable or makes it possible or makes it acceptable as an intervention because data, scientific data that has been analyzed is backing such intervention. This is very important to know. Now, it's also important to note that when you discuss public health, there are some functions of public health. The number one function that you have is that public health wants to collect and analyze data in all sorts of ramifications in every kind of health issue, problem, or disease. You want to be able to collect data, and that's what public health does. It collects a large amount of data. Secondly, after collecting this large amount of data, you want to be able to analyze the data. You want to know what the data is saying. And so a lot of analysis goes into public health. There's a lot of analysis of data. You want to collect data, you want to analyze data. You also want to ensure that healthcare is available for all, for both the rich and the poor. So you want to do interventions that are friendly to both the rich and the poor. You want to pass policies, you want to pass legislation, you want to do laws, you want to, advocate for laws that are going to cut across all strata of society, whether it's the rich, the middle class, or the poor. So this is important for public health because remember that public health is, interested in populations, not just the individual. Now, before we round off, we can talk about a little of some of the disciplines that we have in public health. There are many disciplines under public health. There's epidemiology. These guys are looked at as disease detectives or health related events detectives. So any scientist that does a lot of work with gathering data, with finding out about diseases, trying to know the cause of diseases, the determinants, the risk factors, the spread, geographical locations of diseases, everything that has to do with the disease, such individuals are epidemiologists. We also have environmental health scientists or environmental health public officers who look at the environment. They want to look at how the environment affects public health. Every aspect of the environment is not just sanitation. No. Every aspect of the environment, chemical pollutants, everything that happens in the environment and how it affects the health of populations. That's what the environmental health officers want to look at. You also have biostatisticians. These are public health professionals that look at data. They gather a lot, the data that has been gathered, they analyze this data using very complex scientific analysis, complex procedures to be able to bring out information The idea is that at the end of the day, all this data that has been gathered, especially by epidemiologists, they want to make sense of the data so that policies, advocacies, legislatures, and laws can be made, that are evidence based, based on data which has been gathered. And so this is very, very important for us. We also have people who are in health policy and promotion. These are also healthcare, these are also professionals in public health who are very busy doing advocacy, trying to change laws, trying to change policies, trying to do regulations. Also, they do a lot of awareness campaigns. They also want to be fully involved in, health promotions at the markets, at the mosques, at the clubs, everywhere where people gather together. It's important to get information out to them, and it's important to make them understand the different ways that our lifestyle can affect our health. So, this is a brief introduction to what public health is all about. We'll also take further videos where we discuss very many various concepts in public health. Thank you for listening and have a beautiful day.